Dear friends, today we are going to present the relevance of casework in medical setting. I am Avani LS, MSW first year student, Loyola College of Social Sciences, Trivandrum. First, we are going to see an introduction of the entire presentation. As we know that the social workers play a great role in the hospital setting because they help the patient and the families to address the impact of illness and the treatment. So we know that there is always a tremendous stress which results from illness and injury and the subsequent hospitalization. Let's see what the stressors are. Some of them are decreased personal control, information overload, change in functional ability, and reduced financial resources. These stressors can lead to a range of emotional responses such as anxiety, anger, and depression. So, social workers' role is to provide assessment and appropriate interventions to aid the patient in achieving optimum recovery or rehabilitation and quality of life. Let us try to understand the history of social workers in the health setting. The first social workers were appointed in hospitals because it was recognized that patients needed intervention on psychosocial aspects of their illness. Treating the physical without addressing the psychological and social did not bring sustainable results. These social workers visited the houses of patients and provided psychosocial support to them. In Britain, the medical social workers were primarily known as hospital almoners and lady almoners until the profession was officially renamed medical social worker in 1960s. Subsequently, the Institute of Almoners, established in 1945, was renamed as the Institute of Medical Social Workers in 1964. In Britain, medical social workers were transferred from the National Health Services (NHS) into local authority social services departments in 1974 and generally become known as hospital social workers. In the United States, the Massachusetts General Hospital was the first American hospital to have professional social workers on site in the early 90s. And Garnet Pelton, Ida Cannon, and Dr. Richard Cabot were the central figures of the hospital social work. Cannon started specific training for medical social workers in 1912. The major duties carried out by medical social workers were case management, data collection, follow-ups, care coordination, health education, financial assessment. Then in India, in 1936, Dr. Clifford Mansharat, an American missionary, he started formal training in social work in India through Dorabji Tata Graduate School of Social Work. And the first medical social worker was appointed in 1946 in JJ Hospital, Bombay. In 1960s, scope of medical social workers increased in India. In the case of India and Britain, we see a gradual evolution. Hospital almoners to renames medical social worker, founding of various institutes Britain as well as in India. And these are the general functions of a hospital caseworker: assessment and care plan, case management through psychosocial interventions, concrete service assistance, care coordinator, collaboration, discharge planning, advocacy, community health and documentation, etc. Now we are going to see the core components of the presentation, the functions of hospital social workers, assessment and care plan. First of all, his duty is when the patient is admitted to the hospital system, the hospital caseworker is supposed to carry out the initial screening and evaluation of the patient as well as the family. Also, his or her task doesn't end up with the initial screening. He or she should conduct the assessment of the bio, psychosocial, and ethno-cultural needs of the patient, family, and the support system. So, the social case worker actually takes a comprehensive view which doesn't end with the biological and psychological level, but it covers the entire environment of the patient. and he or she has to facilitate decision making on behalf of the patient and families. Sometimes the patient and families have ignorance for the ignorance. For example, they may be unaware of the exact detail of the surgery. So, in those cases, a social caseworker has the duty to provide education and facilitate the decision making process, and also assess community and other large system factors impacting patient health and treatment. That is the social factors that really have an impact on patient's health and treatment. The social casework can involve in community organization and activities to solve problem at the macro level, educating hospital staff on patient psychosocial issues. Most hospital staff are primarily equipped with the handling the biological needs of the patient. The hospital caseworker, who is an expert on the psychosocial aspect, is an active member of the medical team, helping other hospital staff understanding the importance of holistic assessment and intervention. The hospital social worker also provide psychosocial interventions that facilitate patient and family adaptation and well-being. Then case management through psychosocial interventions. Social workers in healthcare commonly provide individual, couple, group and family counseling, crisis intervention, patient or family education, resource referral and advocacy in inpatient and outpatient setting. Because social workers can provide both the psychosocial care and other services to the patient and family, duplication of service is reduced. A mutually developed care plan for each patient or family is based on skillful psychosocial assessment. Consultation with the medical and allied health professionals is implicit in developing and implementing treatment plans. The next is concrete service assistance. The term concrete service assistance, very much practical, encompasses any of the basic needs that a patient might have, including housing, food, clothing, or assistance with the utilities. Many patients who are in community hospital settings, especially in our government hospitals, have more than one of these unmet needs. Hospital community caseworkers help patients to obtain needed services through a variety of interventions such as advocacy and referral to social services or community organizations. The hospital caseworker notices with regard to particular patient's unmet needs are there. In that, a hospital caseworker can help the patient to obtain the needed services through variety of interventions, advocacy, or a referral to some NGOs. For example, Pallium India. According to the health services, caseworker may also patients with obtaining medication to assist patients with the application for disability benefits or insurance payments. Some caseworkers also make house visits to patients who might need additional help readjusting to home life. They may inspect the patient's home to ensure that there are no safety hazards, assist patients with obtaining needed adaptive devices or equipment to make their lives safer and more independent. Then next is care coordination. Care coordination is one of the main tasks of a hospital community caseworker. In a patient is admitted in a hospital, he or she may have to receive help and treatment from different department or institutions. Example, in a hospital, patient may be under the care of several professional and organizations such as private family physician, home care organization, or social services. What are the roles of a care coordinator? According to the Case Management Society of America, reducing the fragmentation of care is the primary goal of medical caseworker. This is based on the assumption that care should not be compartmentalized or partialized. Fragmentation of care can result in errors in diagnosis, delays in insurance payment, or even increased treatment costs. Caseworkers are responsible for coordinating all services to reduce the potential for this to occur. And the next is collaboration. Collaboration with the healthcare providers is a key duty of a medical social worker. This is done as a part of interdisciplinary treatment team, which include professionals such as nurses, doctors, physician assistants, and physical therapists. The social worker helps to facilitate communication between team members and the patient, as well as the patient's families. And the next is discharge planning. Hospital community caseworkers must begin the planning processes for a patient's discharge as soon as possible. Discharge planning involves taking into account all of the services a patient might need to readjust to home life. Discharge planning, which is a vital part of case management in social work or services, can also be defined as a process where a patient receives assistance in developing a healthcare plan to make sure that he receives ongoing healthcare maintenance even after being discharged from the hospital. It is also called continuity of care and it aims to offer services that can help a patient become more independent despite his illness. Apart from this, hospital caseworkers perform many additional tasks to ensure the smooth delivery of the patient services. This may involve administrative responsibilities such as maintaining patient files, completing detailed case notes, or performing periodic reviews of services that have occurred from intake to discharge. It can also involve community with the physicians and other healthcare professionals or discussing a patient care with the family members or other involved parties. The next is advocacy. Medical social worker act as a advocates on behalf of the patient. This may include making the patient's wishes known to the family and the treatment team, or making sure the patient receives accurate information about his care and treatment. Social workers are particularly involved in assisting patients in creating advances directives, which offer clear instructions as to the patient's wishes in terms of medical end of life decision making. Example, regarding donation of organs, how the patient wishes to spend the rest of life in treatment, etc. In the medical setting, the hospital social worker acts as a link between the doctor and the patient. She acts as the source of knowledge for the client. The hospital social worker may also work as the part of community healthcare organizations. The workers understands the social cultural pattern of the community, the healthcare pattern of the community, the need of the community, and interprets these to the team of the other professionals with whom she works. Her main role in the community is to elicit participation of the community in planning their health care, provide health education, and help them to use preventive services effectively. In psychiatric setting, she does the mental status examination of the client, understands the psychosocial problems of the client, and interprets the same to the same to the psychiatric team. Her role also includes counseling and education of the family to understand and accept the client. And these are the references. Thank you.